if you were talking to someone in the middle of treatment who may not have the physical strength to even do a 10-minute walk, what do you say?
Okay. So for that 10-minute person, the the key is to kind of keep make it realistic for you, right? Give yourself everybody should be giving themselves a little bit of a break, given that they're going through this. But I say not so much of a break that you're not doing anything, because you don't want to be static. You want to make sure that you are doing things, and that for let's say the beginner or the person who just feels completely exhausted, think of all the modifications that you could do, whether you're going to do a modified plank on the kitchen counter, so you've got your arms up and your feet are out and you're not on the floor, you're on the counter or you're on the bed or you're on the chair. So you're just doing some of these modified exercises, but at a sort of kinder, in a gentler way. And build from there, but really kind of have a plan as far as, okay, I can hold this plank for, the countertop plank for 10 seconds, and kind of challenge yourself to bump it up a little bit more to 15 seconds. I feel that it's important to sort of push it a little bit more than you might normally feel comfortable. And maybe if you're not comfortable with it at all, you still have to kind of gauge out what you are doing so that you're making progress. Because if you're just doing the same thing the whole time, you won't make as much progress. And to keep yourself moving.
Quick pause. I'm Samira, a cancer survivor. This channel shares real stories in an easy to understand fashion, guidance for the hard moments during the cancer experience. If this helps you and it helps you having us in your corner, you can subscribe for more videos like this. Now back to the show.
For that person who is in treatment, it's really important for, if you're in, pre-treatment or going into treatment, is to do exercise. Your outcomes are going to feel better during the process. You're going to have much more energy. So I would say that walking is really key. And if you can walk, I say also include some hills. And if you need to have hiking sticks, I usually recommend hiking sticks, even if someone is on a flat surface. A lot of it is, again, if you've got neuropathy, then the balance is going to be an issue. A lot of people don't swing the one arm that's affected. And so the hiking sticks help to force you to put your hand out there and, poke at the ground as you're going up. So that movement of your arms is really key. And so the hiking sticks it's sort of a hack for, also you're going to be burning more calories if you're using a stick, if you're climbing up or down. I mean, they're going to help you on a lot of different levels. So sort of easy things that you can do. Do what you can do within, sort of the parameters, because I feel like that is something that, like, what do I do? Look at what you used to do. You can still do those things that you used to do. Maybe you're not doing them at the same level. And then for somebody who's out of treatment, exercise is something that is, I say, it's the drug that you're going to be taking for choice, for life. Because in some cases, if you don't have a drug that is going to inhibit your tumor, like a triple negative, there's nothing out yet, exercise is the one thing that you can do. And so you really want to make sure that you've got an exercise program, anybody who's post-treatment, because the goal is that you're trying to keep your lean body mass, as high as possible, and your body fat as low as possible.
Thank you for watching the Patient from Hell podcast. I started this because I wish I had something like this when I was going through cancer treatment. On this show, you will find videos and stories from real patients, real survivors, clinicians, researchers, oncologists who share their learnings, life lessons, tips, and tricks to hopefully make the cancer experience just a little easier. To find more videos and stories, you can subscribe or share this with someone you think this will help. Thank you.